Kia ora team, my name is Ben and I've got the Brayden Shaw with me. Ladies and gentlemen, bring him in. Come on!
Start together and spread.
And he's going to auscultate my chest. Okay, where are we starting, Brayden Shaw?
All right, so usually when we go into auscultate, ideally we'd auscultate on someone's bare chest. We wouldn't want to auscultate over top of the shirt as we'll get sound. So when I auscultate, gain my consent. I'm going to make sure my ear tips are in the right way.
So which one is which?
So,
why do we have two different bits?
So this would be a bell on a more traditional stethoscope, and this would be our diaphragm. The bell will give us a lower resonant sound, it's more like a heart sound, whereas our diaphragm gives us our higher pitch sounds, like lung sounds. So usually we want to just use our diaphragm when we're listening for lung sound.
Gorgeous. Okay, hook me up. Where do we auscultate?
So when we auscultate, some of the spots that we can look at are right up here. So we're going to go right in between the clavicles and the scapula. So we can auscultate right up in here because our lungs come right up top. And usually we're going to use a stepwise approach, moving either left to right, right to left. So I'll do one here, and then I can auscultate going down the chest until I reach the ends of the lower lobes. I'm going to auscultate on a bare chest, and I'm going to try and keep Ben modest while I do it. So I don't want to expose him unduly, at least not in this exercise. Great.
Awesome.
So Ben, I'm going to auscultate your chest. I'm just going to put the stethoscope on. If you feel uncomfortable at all, just let me know. So putting in the stethoscope, again, having my diaphragm towards the patient's chest, and I'm just going to apply gentle pressure. So I'm just going to start up here. Deep breaths in and out through your mouth. So just nice, deep, not uncomfortable, don't have to hold your breath. Just
got it.
I move over to this side, but because Ben's mic is here, I'm just going to go over top of the shirt. All right, Ben, I'm just going to go just under your shirt for a minute. Once I've done the front aspect of his chest, so again, we're going to kind of do 6 spots. So 1, 2, 3, 4, 5, well, ideally we go lower, so maybe 8 spots, and we can go lower. The real objective is just to make sure we hear all aspects of the lungs. Some texts will recommend you go even more, and there can be as many as, what, how many spots did we count? 20?
Million. All right, how low are we going? What's the...
So if we go to the xiphoid process, Ben's always going to talk about that xiphoid process. So right, if you feel on your own sternum, you go right down to the base where it gets all pointy. That's your xiphoid process. And if you just take that component, cut yourself in half, you don't need to go any lower than that on the chest.
Gorgeous.
Once we do that front component, we can do the sides, just one on each side, and then we do the posterior or the back. Remembering that when we auscultate someone, ideally having them sit up is best, because if they do have any effusions or any fluid sitting around, it's going to go with gravity. So if they're sitting up, it goes down to the base of the lungs, so you can actually hear it.
Awesome.
Cool.
Okay, so where were the lateral ones?
So if we just go kind of that mid-axial, so right down the shoulder, and we're going to go right up and just down on the side, again, in line with that xiphoid process would be ideal.
Okay, and then posteriorly?
We're going to do the same spots. We don't have to go up in between the clavicle and scapula, but we're just going to go to the back, and we're going to do the same spots we did on the chest. Again, deep breaths in and out through the mouth so that we can hear the most.
Okay. Do we auscultate the throat? Should we?
100% we can auscultate the throat. We can have stridor, as you may be well aware of, that whistling sound. And sometimes that stridor is not going to be very pronounced, so I can't hear it with my naked ears. So actually listening to the throat can give us quite a bit, provided the patient feels comfortable for us to do so.
Okay, where are we going for that one?
So here we can just go right to the side of the throat. So just going right to the side, again, not using the bell, I'm just showing my bell. And ideally using that diaphragm, because stridor will be a higher pitched noise, so we want to capture it better.
Okay, gorgeous. So I hear Brayden Shaw is the only person on the road who percusses. What is percussion?
I don't think I'm the only person on the road who percusses. Percussion is like a percussion instrument, right? It's that sound like a drum. So what we're doing is we're not necessarily making a drum out of someone, but we're actually trying to get different sounds to see what's going on underneath the skin. It can be an important skill, and it can add just a little bit to your repertoire of differentials.
Okay, what do we do?
I'm going to take my middle phalange. I'm going to go to my middle phalanx, so just that little bone in between the tip of my finger and the base of my finger. And I'm going to take the opposite, so my other hand. I'm going to take the same middle phalanx, and I'm just going to be using the point of my finger. And essentially, I'm tapping. When we're doing chest percussion, because that's what we're going to focus on, I don't want to go on top of bone. I want to go in between in the intercostal spaces. And I want to whack as hard as I can on that middle phalanx. Yeah?
Okay, and what are we listening for?
We're listening for really strange sounds. So those strange sounds would be really hyper-resonant. Think of the sound of a drum. You could also be thinking of dull. The chest should sound in between that. It shouldn't sound dull, and it shouldn't sound like a drum. And so the best way to do is to actually hear it.
Okay.
And it's something easy that you could do on yourself, right? So you find in between your ribs, you take your middle finger, and you give it a tap. We should be able to hear the different sounds. And if we go low enough, we should start to hear maybe where our liver would be, or another strong, solid object. Even just going on top of bone will give you that different resonance.
Okay, dull. If we do the lung, then it should sound...
Resonant would be the word for it.
Okay, and then if we go down lower, so just underneath our costal cartilages in our...
Into the liver?
Into the liver, it should sound...
It should sound dull. And even if you go into the costal cartilage at that location, because the liver actually comes right up into thoracic cage. So if you percuss on the liver in your thoracic cage, it will sound dull versus resonant.
Okay, so if I've got a hemothorax and my lung is filling with blood, if I percuss, what am I going to hear?
You'd hear dull, because there's that solid.
If I have a tension pneumothorax and the lung has been moved completely across to the side, and I've just got air on the pleural space, what's that going to sound like?
It should sound hyper-resonant. So it should sound, because all that space is there like in a drum, so it should sound like a big, loud noise. And again, a component of that clinical picture would be your percussion. And if they were tension pneumothorax, they'd probably be a lot more sick than you'd expect.
Yep. Joey said you can percuss your poo. What does that mean?
I don't know.
You don't.
I think maybe Joey was trying to say that you could percuss anything, but I think the limitations of percussion is that we have to know what's normal versus what's not. Percussing your poo makes no difference clinically, obviously.
But it's a good party trick?
If that's the kind of party you like to attend.
Okay. I think he was saying that if you find your poo in your colon, it's going to be more dull than like an emptier spot.
I guess that I was thinking after, but touche.
Oh no, not your poo in the toilet.
Oh yeah, okay. Well, that changes the context a lot, doesn't it?
Okay.
100%. You can percuss your abdomen. You can find out if your poo's there. And again, there's that relevance of what's normal versus what's not. So if someone has a lot of gas, they would probably sound a lot more resonant. Whereas if they had a lot of solid fecal matter, it would sound a lot more dull.
Okay, so Joey wasn't crazy.
No, now that we have the context right.
Okay. But don't percuss the poo outside of the body. That's a waste of time.
I think that's a waste of time.
Okay. Thank you, Brayden Shaw.
Thank you.
Gorgeous. Done.
Fuck me.
Oh, happy studying.